Hello everybody. Today's topic of discussion is gingival enlargement. And as the name suggests enlargement, that means gingiva gets enlarged. We also name gingival enlargement as gingival hyperplasia, gingival hypertrophy. So all these are synonyms that are being used as gingival enlargement. So the one of the MCQs can be, it is also known as gingival hyperplasia. Yeah, the MCQs could be in the form of gingival enlargement questions or gingival hyperplasia or gingival hypertrophy. These all three things are the same. We don't have to get confused in it. And so as the name indicates, any gingival overgrowth is gingival enlargement. Now, basically, overgrowth is a term, enlargement is overgrowth. Now, an overgrowth could be because of hyperplasia or hypertrophy. Now, gingiva is increased in size because increased in size of the cells. So, when it is increased in size of the cells, it is hypertrophy, right? And hyperplasia is when there is an increase in number of cells, like one cell becomes 2, 3, 4, that is gingival hyperplasia. When one cells become from 1 millimeter to 3 millimeter in size, that is gingival hypertrophy. So we have to remember these 2-3 terms: gingival overgrowth, gingival hyperplasia, gingival hypertrophy, and obviously gingival overgrowth. Now, gingival enlargement may usually what we have to focus on is its classification. What are the types of gingival enlargements which we see in the mouth, and what are the treatment plan for these types of enlargements? So we have divided them into certain categories. Like for example, we have inflammatory enlargement, we have fibrotic enlargement, we have combined enlargement, then we have enlargements associated with various systemic diseases. Then there are like certain systemic diseases themselves causing enlargement, neoplastic enlargement, and we have a false enlargement. So this whole discussion or the whole lecture is about the enlargement, types of enlargement. So let's start with inflammatory enlargement. Now basically what happens is, usually we have certain kind of inflammation. Now, always remember, enlargement occurs because of plaque. If there is no plaque, there is no enlargement. The only thing is that plaque which is resulting in normal inflammation in normal public, in normal patients, in the patient which are susceptible to enlargement, that simple amount of plaque will cause an overgrowth. So inflammatory enlargement is just because of the presence of calculus and plaque. Normal inflammation की बजाय उसमें inflammatory enlargement हो जाता है. So talking about the chronic inflammatory enlargement, if you talk about the etiology, definitely plaque. Plaque could be because of the poor oral hygiene or all जो भी plaque के local factors हैं या जो भी local predisposing factors हैं that forms the plaque are actually responsible for chronic inflammatory enlargement. So if you see the clinical features of inflammatory enlargement, it could be either localized or generalized. If you talk about the shape, in the early stages, it forms slight ballooning to form a life preservator bulge around the involved tooth, and then this bulge increases. It will start as a life preserver shaped bulge around the tooth, and this will go on increasing in size until and unless it completely covers the crown. Now, sometimes it can occur as a discrete sessile or pedunculated mass resembling a tumor. It can go spontaneously reduction in size, and it can sometimes go and increase covering the tooth also. But usually if it is not infected, it is पेनलेस. ऐसा नहीं है पेशेंट को एनलार्जमेंट होता है तो वो पेशेंट इज ऑन एनाल्जेसिक्स या उसे पेन किलर लेने की जरूरत पड़ती है. ज़्यादातर पेरियोडोंटाइटिस और एनलार्जमेंट until and unless it is imposed by any acute infections are not painful. Remember, these are painless diseases. Now, one of the local factors that can lead to enlargement is mouth breathers. Now, what happens is in the mouth breathers, the lips are incompetent. Like in my resting phase, my lips are closed. But what happens in the mouth breather, in the resting case, their lips are not closed. They are like little wide open this way. So what happens is the maxillary gingiva is continuously exposed to the environment, causing dryness over here. That will lead to an edematous and diffused inflammation, and sometimes little bit enlargement is also seen, which is very clearly demarcated from rest of the mouth, showing yes, this could be one of the reasons could be the mouth breathers. Now, how this inflammatory enlargement could be treated? Now, we know that the overgrowth is there. The first phase is always scaling and root planing. We always go for removal of all the plaque and calculus that actually led to the enlargement. And after putting the patients on mechanical and chemical plaque control, calling the patient on the second stages, third stages, and all these visits, we have to just wait for that gingiva to get shrinked, right? That overgrowth gets shrinked. Now that fibrotic part which is left and is not responding to scaling and root planing is ultimately treated by gingivectomy or flap surgery in phase 2. We have a surgical removal of that growth. So always remember, enlargement first step is we have to remove the plaque and calculus that is actually causing the enlargement. After we have removed the etiology, we have to wait that gingiva, that overgrowth gets shrinks to how much. After that, we have to see that this is no more shrinking, the phase 1 has responded. We go to the second phase, that is the surgical phase. Either we remove the gingiva, we do the flap surgery and contour the gingiva. Another type of enlargement is drug-induced enlargement. Very common potential questions that is asked in the MCQs. In this, what happened is basically we read in the inflammatory enlargement, the reason is in आपका plaque and calculus that is causing inflammation. That inflammation gets aggravated and forms overgrowth. What happens in drug is certain drugs are potential of causing enlargement. For example, anticonvulsant, immunosuppressants, calcium channel blockers. The patient under these drugs, their gingiva gets modified. Now, inside story is this, that we have a fibroblast. We all know fibroblast is responsible for collagen formation and collagen degradation. So in these patients who are taking these drugs, basically their fibroblast is modified. वो कोलाजन ज़्यादा बनाता है और वो कोलाजन को कम डिस्ट्रॉय होने देता है, तो आपको ओवरऑल एक enlarged mass of collagen दिखता है. Now in MCQs, what is mostly asked is कि which type of drug is responsible. So we have to just remember basically 3 categories ही हैं: anticonvulsant, immunosuppressants, calcium channel blockers. Anticonvulsants हम epilepsy में यूज़ करते हैं. Immunosuppressants मतलब जो immunity को थोड़ा डाउन करे, जैसे कुछ organ donation हुआ है, और that cases, some cases where we require immunosuppressants. And calcium channel blockers are basically used in आपके cardiovascular diseases में, heart diseases में यूज़ होता है. तो ये 3 कैटेगरी ऑफ ड्रग्स ही यूज़ हैं जो एक्चुअली gingival overgrowth cause करती हैं. Let's go detail one by one. And usually the question asked is कि कौन सी drug is responsible for causing the gingival enlargement mainly. So risk factor, so basically drug is the risk. हमने priorly आपको plaque and calculus लेना ही, मतलब that ideally should be there. The patient alone is taking the drug will cause enlargement? No. There are many patients who are on anti-leptic, but every patient has enlargement? No. So the patients which are prone for enlargement, the patient which has modified fibroblast in their body, and plus they should also have inflammation, like plaque and calculus should be there. So these are the risk factors that induces the drug enlargement. Now basically age का कोई रोल नहीं रहता, जितना ज़्यादा dose drug का उतने ज़्यादा chances of enlargement. Definitely duration is required. Like for example, patient is taking the drug since long, patient is more prone for enlargement.